Hello and welcome. My name is Dr. Reed Neubaum. I'm a chiropractor here in Maryland with physical therapy privileges. My wife and I are the owners of Ultimate Health, and we're not your average chiropractic office. Our background and training focus, heavily on rehab, movement, mechanics, and physical therapy based treatments. So, a lot of what we do looks more like performance and rehab than a traditional adjustment only office. We use hands-on care, rehab exercises and modern tools to help people, move better, get stronger, and, stay out of pain long term. And what I'm about to say, might come as a surprise, but one of my favorite things to treat is plantar fasciitis. I know. What a frustrating, painful, and stubborn thing. But I like treating plantar fasciitis because I love to help people like you to get out of pain and get back to what you want to be doing. And it's actually more simple than most people think. So let's dive in. If you're watching this, you're likely dealing with you've already been diagnosed with plantar fasciitis, so I don't need to describe the symptoms to you, but you might be dealing with heel or foot pain and it's just not going away. Maybe it hurts the very first thing in the morning. Those first steps are just killing you. Maybe walking or running, aggravates it. And if that's the case, you've tried stretching, you've tried inserts, maybe even got some injections, and it just keeps coming back. And that frustration usually means something important is being missed. So, what I want to do today is simplify this for you. And we'll talk about why plantar fasciitis lingers, why stretching alone rarely fixes it, and the three factors that must be addressed for it to truly resolve. And that, along with how we can help you along the way. All right, plantar fasciitis, defined, plantar meaning the bottom of the foot, fasciitis meaning inflammation of the fascia. So it's described this way: inflammation of the plantar fascia. Gee, thanks. But that's really incomplete, and it's not a very helpful diagnosis. That's like, a lot of my patients come to me with back pain. It's like if I diagnose them with, hey, I got it, I figured it out. You have low back pain. It just describes what you're already feeling. So the real question that we have to ask is, you have plantar fasciitis due to what? And really it comes down to excessive tension and stress on that structure, on that tissue. So the tension that is there causes inflammation. So things that go into that: poor foot mechanics, tightness in the calves, that and repetitive overload. And if we don't fix the tension source, then the inflammation keeps coming back. The classic symptom is sharp heel pain, especially within the first few steps in the morning. That happens because the fascia tightens overnight, or it's sitting in a shortened position. So when you stand up, it gets pulled suddenly and it's already irritated. So when it gets pulled on, it can feel like a cut. It feels like a knife. And over time, that tissue becomes, irritated and sensitive. But here's the key question: why isn't it healing? And my answer to that is there are too many factors. The plantar fasciitis is almost never caused by just one thing. It's a combination of a lot. Like I said before, tight calves, poor mechanics, and then weak, tiny foot muscles. Overusing your feet, life is coming at you. You have to be able to get around the world and do what you need to do. But when multiple stressors stack up, that's when the fascia becomes overloaded. If you only treat one piece, it's going to return. And here's why it doesn't just go away. All of these three factors have to be addressed. If the calves are tight, they're pulling on the heel constantly. If mechanics are off, every step increases the friction on that structure. You take thousands of steps per day, or at least you should. That's thousands of small aggravations. And unless we reduce the tension and improve mechanics, it's just going to keep getting re-triggered. Most treatments focus on just one thing. So, stretching, it helps, but it's not the full story. Orthotics, foot inserts, it can support your arch, but they don't release the muscle tension. And injections, you shoot cortisone in the spot that hurts, it will reduce inflammation, but it doesn't correct either of those two things. So if you don't address all the contributing factors, the symptoms again return. So don't fall for the trap of only getting one of these things right. Now, these approaches are not wrong. Again, they're just not complete. And that's why many people say, I've tried everything. You may have tried all of these things: stretching, rolling the foot, frozen water bottle, rolling the foot. It's like, it's great and all, but it's only one little piece. And in reality, you haven't tried everything. You've tried pieces, or maybe not the right combination of things. And, to add to the complexity, sometimes it's just not enough. Helpful, but not enough. At Ultimate Health, we don't rely on one tool. We have this saying, we stack the deck. So we got it. One, it makes sense to address all of the factors at once. So we address the mechanics, we release the tension, we strengthen the weak areas, and we have tools to accelerate the healing process. We're going to talk about it more, but that's where laser therapy plays a very major role. So here's how these factors are the key. If the foot and ankle don't move properly, the plantar fascia absorbs more stress than it should. That stress happens with every step. Your foot is curved like this so that it can absorb the forces. It's like a shock absorber. So if your foot's not moving and able to absorb the forces, then the forces have to go somewhere, and that can be the plantar fascia. So that stress comes from poor foot mechanics. Through chiropractic adjustments and myofascial release, we can restore that motion and improve how forces are distributed throughout the foot. So when the mechanics improve, the strain decreases. But again, mechanics are only one piece. The tension. Most people don't realize this. Tight calves and trigger points, like knots, pull on the heel constantly. They are connected even to the bottom of the foot. So even when you're sitting, that tension does not shut off. The two big tools we use for this are dry needling and myofascial release. We physically release those knots and any tension, using our hands or other tools, and it reduces that constant pulling force. But even after we release the tension, there's still inflammation to resolve. And so that's where the laser comes in. Laser therapy, it's the closest thing to a magic wand that we have. So what it does is it increases circulation, and when an irritated tissue gets more circulation, more blood flow, more oxygen, more waste products are able to be removed, then it can calm down. Laser also stimulates the cellular energy production. So think of it like a metabolism booster. That can speed up the process because all the cells have more energy to get rid of that inflammation. So it's not anti-inflammatory. It just makes the process go faster. So think of it this way: chiropractic, physical therapy, needling, they remove the stressors, and then the laser accelerates the healing response. Without improving circulation and cellular energy, recovery is slower. With laser, we have better outcomes and they are faster. One of the biggest myths in plantar fasciitis is that it just takes time. Time alone does not fix the causes. It does not fix your mechanics. Another myth is that better shoes alone solve it. Shoes can help, inserts can help, but they don't release muscle tension or correct the movement patterns. So when someone says I've tried everything, I do believe them, but it usually turns out that they've just tried pieces and, again, not quite enough. So you gotta address all the factors together and then you get the results. And some of the biggest mistakes we see is really just that. You're going back and forth between things that you've seen on the internet, on social media, stretching, not strengthening, ignoring the calves, relying on external things like inserts or injections, and not stacking the deck with the laser to accelerate the healing. So again, gotta treat all of the factors, and then recovery is possible and actually might be a whole lot faster than you might think. So let's talk about the program. Most patients need to complete about 12 visits over a 6-week time period. Some need fewer, some need more. Care is, we customize it. We got to meet you where you're at. It depends on severity. How bad is this affecting your life? How long has it been there? What's your activity level? And then what's your goals? That might significantly change the plan that I recommend for you in particular. So I am talking, averages. Most people need somewhere around 12 treatments, and you got to do it frequently enough. Now, most people, once they get started, begin noticing meaningful improvements within the first 3 or 4 visits. And we love to hear that because, momentum is big, but it does take some time. Oftentimes, if it's been there for a while, I got to manage expectations sometimes. Just getting 1 or 2 treatments might not change anything. Although plenty of my patients do get relief, even if it's a little bit after, just a handful. But 3 to 4 treatments to kind of see how you're doing, that's a reasonable expectation where we want changes in that time frame. And let's just get this over with and talk about cost. It's one of everyone's, we always end up talking about this. So chiropractic and physical therapy typically covered by insurance, as long as we're in network. But in case we don't accept it, or we don't accept your insurance, or if you don't have it, our self-pay rate for chiro and PT is $65 a visit. Laser, not a covered service. It's just not covered by insurance, even though it's been around for these purposes, cleared by the FDA since 2003. It's still considered new and experimental. So cost for laser therapy is $90 a treatment. We do have packages for that. We both have a 6 and a 12 pack, but the 12 pack is $925. In dry needling, $35 a session, or we have a package for, well, it's really 4 for $100. So to get you 12 treatments, that would be $300. First things first, we have to consult. We have to examine you. I have to hear your story, what's going on. And during that consultation, we'll be able to determine what combination makes sense. So plenty of people get benefits from, some of these things. Depends, one, can you make it to the office for treatment at a regular basis, and can you afford these things? That goes into this decision. So the right combination is different for everybody. So these are just more general recommendations, but this is something that we can talk about, if we meet. It's, I'm here for you to make the best decision for you. Plenty of people make progress with just the chiro side, just dry needling, or just laser therapy. It really depends person to person, but we can talk about that, and I'd love to meet you and help you with it. So if this resonates with you, the next step would be scheduling a consultation. Again, I got to get your history and got to do an exam and identify all the contributing factors. Find out if what I'm telling you about is right for you. So there's no pressure. I just want to give you clarity and direction on what the best decision is for you. And to get started, just scroll beneath this video and fill out, there's a form there. And if you have any questions or just want to call or text the office directly, my number's right here on the screen. And if you have any questions too, here's my personal email. I'll do my best to answer any of your questions ahead of time. And just so you know too, we got 2 locations. A lot of people don't know about our Towson location, but we can do these treatments in either office. But our Bel Air location is just south of downtown Bel Air on 924 Emerton Road. And then down in Towson, we're right off of Osler Drive in a big medical professional building, real close to campus. So again, thank you for taking the time to watch this presentation. And listen, I'm here for you. It's no way to live. Plantar fasciitis is such a impactful thing, and I hate seeing people suffer with it. So I would love to help you out. All right, talk soon. Bye-bye.